Okay, so welcome to this video. In this video what we're going to talk about is depression, and we're also going to talk about the treatment of depression with antidepressants mainly. Okay, but we will also mention psychotherapy and also electroconvulsive therapy as other treatments of depression. Okay, right, so the structure then for this video, we're going to start off by talking about the two major types of depression, which are unipolar depression and bipolar depression. Okay, and we'll talk about the symptoms of each of those. We'll then talk about the definition of major depressive disorder as defined in the DSM-5. Okay, then what we'll do is we'll talk about the cause of depression, or at least what is understood about the cause of depression. Okay, so we'll talk about we'll talk about the cause of the actual depressive periods of depression, so either the depressive periods in major depressive disorder or the depressive periods in bipolar disorder as well. Okay, and what we'll look at is the role of the anterior cingulate cortex. We'll then talk about the connections between depression and chronic stress. Okay, and we'll also talk about the monoamine hypothesis. Okay, then finally we'll come on to the antidepressants, and then we'll mention the psychotherapy and electroconvulsive therapy as well. Okay, finally what we'll talk about is the use of lithium to treat bipolar disorder. Specifically, it's very good at treating the manic phases of bipolar disorder, but it's also good at treating the depressive periods of bipolar disorder as well. And we'll talk about what is understood of the mechanism of lithium. Okay, right, so that's the setup for this video then. Okay, so we're going to start off then with a few pieces of terminology. Okay, so the first important pieces of terminology that we need to deal with are the difference between unipolar depression, okay, and also bipolar depression. Okay, right, so uni means one, bi means two. So unipolar depression means that you have one pole, effectively. Okay, now in unipolar depression, you just have periods of depression, basically. You have periods of intense mental sadness or irritability as well. Bad mood, basically. Depression is periods of very, very bad mood. And in these periods, you often feel very, very sad, but also you can feel anger and irritable as well. Okay, so in unipolar depression, all you have is these periods of bad mood, and then occasionally you'll have periods of normal mood as well. Okay, so in this unipolar depression, you only go into bad moods, basically. Whereas in bipolar depression, which is much, much rarer, you have not only periods of depression, okay, so you have periods of bad mood, but then you also have periods of what are known as mania. Okay, and in periods of mania, you are in a fantastic mood. You are described as euphoric. Okay, and we'll describe more of the symptoms of a manic period later on. So people with bipolar depression, sometimes they'll be in a normal mood, but then at other times they'll be in a horrendous mood, a horrendously bad mood, and then at other times they'll be in a manic euphoric mood. Okay, so those are two very important different types of depression, bipolar and unipolar. And as I say, unipolar is far more common than bipolar depression. Okay, right. So, now I just want to give you two other little pieces of nomenclature before we discuss the symptoms of unipolar depression. Okay, so depression can either be classified as primary depression, okay, or it can be classified as secondary depression. Okay, now what does this mean? Well, basically, primary depression means that the depression arose on its own, basically. Okay, it's not secondary to anything else. In fact, it's probably easier to define primary and secondary by first defining what secondary depression is. So secondary depression is when it arises potentially because of something else that's happened. Okay, so for instance, if you're put on certain drugs, those can induce depression. Okay, and we'll talk about a very famous example later on. We'll talk about the drug reserpine, which is one of the founding pieces of evidence for the monoamine hypothesis of depression. Okay, so secondary depression arises because of some prior pathology. Okay, so for instance, you're taking certain drugs. Okay, or there are other conditions, other pathological conditions which can then lead to depression. Okay, so a good example is hypothyroidism. Okay, when you have too little thyroid hormones being secreted by your thyroid gland. Okay, right. So secondary depression arises secondary to an original pathology, whereas primary depression then is the depression that's more common, that doesn't arise because of, well, at least it doesn't arise because of a previously understood pathology. So we don't potentially, what we are classifying as primary depression later on, in 50 years' time, we might understand that there is some previous pathology that is causing it. But at the moment, it appears to be occurring spontaneously. It's a pathology in itself, basically. Okay, so that's what primary depression is. It isn't arising because of anything else. It's arising on its own. Okay, right, so those are two pieces of terminology that are important. Okay, right, so now what I want to talk about is the symptoms then of unipolar depression. Okay, and then what we'll do is we'll discuss the definition of major depressive disorder in the Diagnostic and Statistical Manual of Mental Disorder 5. Okay, right, so unipolar depression, okay, which is the main form of depression. Okay, so firstly, in unipolar depression, what you have are these depressive periods. Okay, so you'll have long periods where you have a depressed mood, okay, or in a very bad mood, either very sad or angry and irritable as well. Okay, now, these depressive periods can last between 4 and 12 months, okay? And then after one depressive period has ended, then you'll go back to normal. And then, if you're unlucky, what will then happen is, after a certain amount of time in remission, you'll then relapse and you'll have another depressive period again. Okay, so you go in these cycles of being in depressive periods and then being in normal periods and then being in depressive periods and then normal periods. Okay, right. So what we're going to discuss are what are your symptoms when you are in one of these depressive periods. So what is it actually like to be in one of these depressive periods? Okay, right, so we'll divide the symptoms up into different aspects. So we'll start off with the obvious one to start off with, which is the psychological symptoms. So the symptoms that affect your mood, basically, how you feel. Okay, so the obvious one then is that you have a very low mood. Now there is a fancy word that means that you have a low mood, okay, and this is dysphoria. Okay, so when someone says dysphoria, that means that someone is suffering from a low mood, okay, and the adjective is that they are dysphoric. Okay, right, so this low mood, as I've been hinting to, can involve periods where you're very sad, okay, and also periods where you're angry, okay, so anger, and also irritability. Generally their irritability goes up whilst they're in one of these periods. Okay, irritability. Okay, so those are the symptoms of a dysphoric mood. Okay, so that's the key word there, dysphoria. Okay, there's another very key word whenever you're talking about the psychological symptoms of depression, which is anhedonia. So dysphoria and anhedonia are the two key words to describe the psychological symptoms of a depressive period. Now, what does anhedonia mean? Anhedonia means an inability to experience happiness, okay, or pleasure at all, really. So if something good happens to someone in a depressive period, okay, they just won't feel happy at all. They don't have a happy response to anything, really, okay, and that's what this word anhedonia means, inability to feel happiness. Even when good things happen, they won't be happy about them. Inability to feel happiness. Okay, right. So those are the two key psychological symptoms of unipolar depression. Now let's move on to the physiological symptoms of unipolar depression. So these are the psychological ones, and now we'll have physiological. Okay, right. So one of the very important physiological symptoms of unipolar depression is that you generally have sleep disturbances. People with in a depressive period will have problems with sleeping. Okay, now this can take two different forms. Okay, so in different people you have two different symptoms that can arise with sleep. The most common thing to happen is that they get insomnia. Okay, they struggle to sleep really, really badly. Okay, so insomnia is what usually happens in depression. Okay, however, in some cases of depression, you can instead get excessive sleeping. So instead of not wanting to sleep, instead they want to sleep all the time, basically, and they'll struggle to get out of bed. Okay, and when I say struggle to get out of bed, I don't mean normal struggling to get out of bed. I mean really struggling to get out of bed. Okay, right, so that's one of the key physiological symptoms of depressive periods. Okay, another key physiological symptom of depressive periods is that you lose your appetite generally. Okay, so lost appetite. Okay, and generally, because of the loss of appetite, they then tend to lose weight. Okay, so they lose weight. Okay, so that's a key physiological symptom of depressive periods. And finally, you have very, very low energy whilst you're in a depressive period. Okay, so those three symptoms are the physiological ones, so I'll bracket these up here. I think I might even colour them in. So we'll have the psychological symptoms here, bracketed in red. We'll have the physiological symptoms here, highlighted up in yellow. Right, okay, next what we'll do is the behavioural symptoms, so how your behaviour changes in response to being in a depressed period. Okay, so there's a very important key word with regards to the behavioural symptoms of depression, and this is psychomotor retardation. So what does this mean? So retardation means to slow something down. Okay, so psychomotor retardation means that your movements are generally slowed down. Okay, so generally your movements will be slower than when you're not in a depressive period. So slower movements is one of the behavioural symptoms of depressive periods. Okay, so here we'll have behavioural in green here, and that's a key word, so I think psychomotor retardation should get highlighted in green as well. Right, okay, now we'll turn on to the cognitive effects. Okay, so cognitive means your ability to think. Okay, so it's different from psychological. Psychological is all about your mood. Physiological is all about your body. Behavioural is all about what someone who isn't inside your head and is just watching what you're doing can diagnose. And cognitive is about what you're thinking, so cognitive effects. Okay, right. So the cognitive side effects then, these are quite vast, as you would imagine as well, because depression fundamentally is some sort of problem on the level of the brain. Okay, so generally you have horrible thoughts. Okay, so the thoughts that you end up having are of helplessness, okay, and hopelessness. Okay, so they generally have feelings of hopelessness or thoughts of hopelessness. Okay, they generally end up reliving periods where before they were in the depressive period. Okay, so when you're in the depressive period, they'll generally relive memories from long ago when they were not depressed. Okay, and they'll sort of just wish that they could go back to those. Okay, so reliving memories that were prior to the depression. Okay, and the other key thing that you can't miss out here is that they have suicidal thoughts. So they start to think about committing suicide and how you could potentially do it. Okay, whereas healthy people do not even think about suicide at all. Okay, right. So the other key things that happen with regards to cognition. So these are all about what thoughts you end up having. Okay, the other key things are that your ability to remember things goes down, so memory is decreased, and we'll talk maybe about the potential explanation for why memory is decreased in depression. Okay, that's potentially due to problems on the level of the hippocampus, so we'll come back to this one here. Okay, in addition, the ability to concentrate goes down, so concentration goes down, and also the rapidity with which you can think goes down. So generally slow thinking as well is a side effect of depressive periods. Okay, so dysfunctions in memory, concentration, and thought altogether. Okay, so those then are the cognitive symptoms of depression. And then finally, in severe depressive periods, you can also get a fifth category of symptoms, which are put in the psychotic symptoms. Okay, so the final category of symptoms, and this only occurs in very severe depression, are psychotic symptoms. Okay, psychotic symptoms are more common in bipolar depression, as we'll see, in the manic periods of bipolar depression. Okay, so firstly, let me just make sure that everyone understands what psychotic actually means. So psychosis is another name for schizophrenia. Okay, so psychosis means schizophrenia. So psychotic means pertaining to psychosis or pertaining to schizophrenia. So these are the symptoms that are going to be similar to symptoms seen in schizophrenia. So what are the key symptoms that are seen in schizophrenia? Well, you get hallucinations and delusions. Okay, so I want to make sure that you understand what the difference between a hallucination and a delusion is. Okay, so we'll start with a hallucination. So basically, normally what is happening is our sensory apparatus, such as our auditory system and our visual system and our taste system, these are collecting sensory information about sensory stimuli that are actually there, okay, and they're feeding it to the brain, okay, and then we get some sort of conscious perception of those sensory stimuli. What would happen if all of that machinery became active even though there was no sensory stimuli? Then your brain would still actually see things, your brain would still hear things, you would still taste things, depending on which of these apparatuses was going wrong. Okay, so that's what a hallucination is. A hallucination is when you get the conscious perception of seeing or hearing or tasting something, some sort of you really do perceive a sensory stimulus, but there is no sensory stimulus there. So there is some sort of problem with the machinery inside the brain which is actually processing that, and it's basically generating spontaneous activity even though there is no sensory stimulus. That's a hallucination, when you get sensory perception even though there is no sensory stimulus, basically. Okay, so for instance, you can have visual hallucinations where you see things that are not there. You can have auditory hallucinations where you hear things that are not there. Okay, and those are particularly big in schizophrenia, auditory hallucinations. They hear voices that aren't there. Okay, now the difference between a hallucination and a delusion. Okay, in a hallucination, generally the people having hallucinations, they will understand that they are not really there. They will understand that they are not real. Whereas in a delusion, you actually believe that believe things that are not real. Okay, so delusions are kind of a step up from hallucinations. Hallucinations, you see, hear, taste, feel things that aren't there. Okay, but you realise when someone tells you that they're not there, you will accept that they are not there. In delusions, you truly believe in things that are not true, okay? Now, potentially these could be because you're having hallucinations. You could have hallucinations and then believe that the hallucinations are real despite other people telling you that they're not. Or it could be a totally different delusion. So, for instance, people with bipolar depression often begin to feel that they are... well, actually, I'll give you an example from unipolar depression rather than bipolar depression. Okay, so in unipolar depression, people often end up believing that they smell terrible, okay, even though they don't, okay, and they truly believe that they smell terrible, okay, so this is again one of these, well, it's linking back to their feelings of self-worthlessness and sadness, okay, so beliefs that are not true, basically. They believe things that simply are not true, even after people tell them that they're not true. Beliefs that are not true. Okay. So that's what a delusion is and what a hallucination is, and these are two of the key symptoms of schizophrenia. Okay, so that's why they're called psychotic symptoms. Right, okay, so those are the psychotic symptoms then. Right, so those now are the 5 key symptoms of depressive periods. Now, of course, in a single person experiencing a depressive period, you might not see all of these, okay, particularly these psychotic symptoms. These are in more severe depressive periods. Okay, right, so now what I want to talk about is the Diagnostic and Statistical Manual of Mental Disorders definition of major depressive disorder. Okay, so firstly, let me tell you that there is a book which doctors use to diagnose mental illness, okay? And this outlines the symptoms of mental illnesses. And you have to understand with mental illnesses that the diagnosis of it, well, actually, not just the diagnosis, the definition of mental illnesses is based completely on symptoms, okay? It's not based on an underlying pathology, okay? So, for instance, in a heart attack, if we look at the definition of a heart attack, it's that part of the heart muscle is dying because of lack of blood supply. Myocardial infarction, the name gives it all away. Okay, so in that case, it's not defined on the symptoms that you experience in a heart attack, it's defined on the underlying pathology. In mental disorders, we don't know what the underlying pathology is. We have guesses, okay, we have clues, we have tantalizing clues, which I'm going to tell you about in a moment, okay, but we don't know what the underlying pathology is. So instead of defining these disorders on the basis of their underlying pathology, we instead have to define these disorders on the basis of their symptoms. Okay, so the DSM is the book which tells you the symptoms that define each of the mental disorders. Okay, so what does it stand for? Firstly, it stands for the Diagnostic, okay, that's the D, and then it's and Statistical Manual, okay? So the D is for Diagnostic, the S is for Statistical, and the M is for Manual. And I always found it strange, and I still do find it strange, that actually nowhere in this abbreviation is the and of mental disorders, okay, which is what it's all about. So in the abbreviation there's no mention of the mental disorders, but that's what it fully stands for, the Diagnostic and Statistical Manual of Mental Disorders, okay? And there are many copies of the Diagnostic and Statistical Manual that have been updated over the years. The most up-to-date one now is the Diagnostic and Statistical Manual number 5. Okay, right. So, in this Diagnostic and Statistical Manual of Mental Disorders, the condition major depression, okay, is defined. Okay, now major depression is also sometimes called major depressive disorder. They're the same thing, okay, and because it's sometimes abbreviated to major depressive, sometimes it's called major depressive disorder, it's abbreviated down to MDD for major depressive disorder. Okay, but we'll just call it major depression. Okay, so major depression then is defined as 2 weeks of having these depressive periods. So if you've had a depressive period for greater than 2 weeks, then that's defined as major depression. Okay, so a depressive period, and I should have said it's a unipolar depressive period, and a primary unipolar depressive period. Okay, so it's not induced by some sort of drugs that you've been taking. Primary unipolar depressive period for greater than 2 weeks. So that's the definition then of major depression, and we've described now what the symptoms then of what the symptoms of a unipolar depressive period are. Okay, right. Now I also want to tell you about what dysthymia is. Okay, so in dysthymia, what happens is that you end up having depressive. Well, actually, firstly, before I tell you what dysthymia is, let me tell you about how major depression usually works. Okay, so firstly, major depression. Firstly, let me just tell you that to have major depression, you only need to have had one depressive period that has lasted for greater than 2 weeks. Okay, so you don't need to have started going into the remission relapse cycle. Okay, however, generally what happens in major depression is that you have a depressive period and then it gets better. Okay, so it goes into remission. So remission means that it gets better. Okay, it stays in remission for a while, and then what happens is it relapses. Okay, so relapses means it goes back to being bad. Okay, so you go back into another depressive period, and then you stay in that depressive period for a time, and then you remiss again, and you go back into remission for a certain amount of time. Okay, right, so contrast that now to dysthymia. Okay, in dysthymia, what happens is that you are just continuously in a chronic depressive period. You do not have the remission relapse cycle. Okay, instead you just remain in a chronic depressive period that needs to last for greater than 2 years. So for the diagnosis of dysthymia, you need to have been in a depressive period for now greater than 2 years. Okay, now generally the depressive period, the depressive state that you are in dysthymia is milder than in major depression. So what I mean is that although the depressive periods in major depression do not last as long, generally your mood is worse. Okay, you feel sadder, you're more depressed than you are in dysthymia. Okay, so the symptoms of the depressive period are generally milder in dysthymia. Okay, right, but obviously you have the side effect of it lasting for an incredibly long time. Okay, right. Now, before we then turn our attention onto bipolar disorder, what I just want to say is that major depression usually occurs in it usually begins in people less than the age of 25. Okay, so under 25 it usually begins. Okay, and also it's more common in females than males, okay, at least after puberty. So in children, prior to puberty, it's actually equally common in both boys and girls, okay, but after you hit puberty, it becomes, I think, about 1.7 times more common in girls, okay, more common in girls than it is in boys. Okay, so girls after puberty seem to have more of a risk of developing major depression than boys. 1.7 times more common in girls than boys after puberty. Okay, but it's equally common in boys and girls prior to puberty. Okay, right. So now let's turn our attention from unipolar depression to talking about bipolar depression. Okay, and then we'll move on to what is understood of the actual pathogenesis of depression. Okay, right. So bipolar depression. Okay, so firstly, in bipolar depression, you have periods where you are normal. Okay, then you have depressive periods, and those depressive periods are exactly the same as they are in unipolar depression. So all of what we've just described goes for the depressive periods in both unipolar depression and bipolar depression. So that all carries over. Okay, the new thing that occurs in bipolar depression is that you also get periods of mania. Okay, so you get what are known as manic episodes. So what we now want to describe are what are the symptoms of a manic episode. Okay, right, so we'll split it up into the same categories as we did for depressive episodes. So, we'll start off with the psychological symptoms. So how does it affect how you feel? How does it affect your mood? Okay, well, the key word here is that you feel euphoric. Okay, so you get euphoria, which is a sense of incredible happiness. So people in a manic episode feel incredibly happy. Okay, right, so that's the key psychological symptom of mania. Okay, now let's talk about the physiological symptoms. So the physiological symptoms are quite famous. They have incredibly high energy and they don't seem to need to sleep. Okay, so very high energy and very little requirement for sleep. Okay, so they sleep hardly ever. Okay, so the sort of example people generally give you when they're describing bipolar behavior is that bipolar people in a manic episode with bipolar depression will be up at 2 a.m. in the morning, busying around, thinking that everything's completely normal, and they'll be doing, they'll be manically cleaning their house or something. Okay, doing spring cleaning at 2 a.m. in the morning, some sort of behavior like that. That's a little bit stereotypical, but that gets the message across here. Okay, so those are the physiological symptoms of manic depression. Okay, now let's talk about the behavioural symptoms. Well, I've already sort of talked about this. Okay, generally they will have very high energy, so they'll be doing things very, very quickly. Okay, but another aspect of their behaviour in a manic episode is that they become very, very impulsive. Okay, so what does that mean? That means that they don't think through very well what the pros and cons of doing something are. They just do it, okay? They come up with an idea of doing something and then they say, yes, we'll do that, without really weighing up what the pros and the cons are. That's what is meant by impulsive behaviour, that you do things without really thinking through what are the benefits and what are the side effects. Okay, so the archetypal example of this is that they'll go on spending sprees, and they'll spend a huge amount of money that they don't really have, basically. So they often get themselves into financial troubles. Okay, so that's an example of impulsive behaviour. In addition, they often have very inflated self-esteem. Okay, and this can reach delusional points. Okay, so they often end up, well, they don't often, but they end up thinking that they're potentially royalty, okay, or prophets, or deities even. Okay, so inflated self-esteem, and they can end up thinking that they're royalty. Okay, so that's the behavioural changes in manic episodes. Okay, now we'll move on to the cognitive symptoms. So the cognitive effects of a manic episode are that they generally talk very, very fast. Okay, so talk very, very fast, and they also tend to jump from idea to idea extremely rapidly. Okay, so jump from idea to idea without really any sort of logical connection between the two. So they'll 1 minute be talking about something, and then they'll be talking about something completely different, and then they'll be talking about something completely different again. So jump from idea to idea. Okay, so it's almost as though the brain is overworking, basically, but without any sort of sewing together of ideas. Okay, jump from idea to idea. Okay, and then finally let's talk about the psychotic symptoms. Now the psychotic symptoms are usually present in manic episodes, whereas they're much rarer in the depressive episodes. Okay, so generally people in manic episodes can end up having delusions. Okay, so a delusion, an example of a delusion would be the delusion of having special powers, for instance. Okay, right, so those are the symptoms then of a manic episode. So I'll colour in the psychotic symptoms in yellow here. Right, okay, so let's now talk about the Diagnostic and Statistical Manual of Mental Disorders definition of manic depression. So what do you have to have had in order to be diagnosed with having bipolar depression? Okay, right. So as far as the DSM-5 is concerned, all you need for the definition, to be diagnosed with bipolar depression, is you need to have had one manic episode. Okay, you don't even need to have had a depressive episode yet. If you've had one episode of mania, then you are diagnosed with manic depression. Okay, right. Now, for bipolar disorder, it's generally diagnosed in young adulthood. Okay, so similar to major depression, it's again something that, if it's going to occur, it will occur generally in young adulthood. That's where it generally begins. Okay, and in the case of bipolar depression, it is equally likely to occur in both boys and girls. Okay, so unlike major depressive disorder. Okay, right. So we'll call it there for this video, and in the next video what we'll move on to is looking at the causes of depression. Now, we are going to completely focus on the causes of the depressive periods in both major depression and also in bipolar depression. We are not going to talk about really the cause of the manic periods in bipolar depression, because those aren't very understood at all, okay? But we will look at what is understood about what causes the depressive periods that occur in major depression, and also the depressive periods that occur in bipolar depression, okay? Because it's believed that it's the same thing that's occurring in both the depressive periods in major depression and also the depressive periods in bipolar depression. Okay, right, so we'll do that in the next video.